the task force is very straightforward. It is to recommend actions to directly address the racial disparities in the mortality rate that has been seen from COVID-19. So Michigan was one of the first and still remains one of the few states to report out its coronavirus test results based on racial and ethnic lines. And what became evident very early and unfortunately has sustained is that there is a very differentiated impact on communities of color and on the Black community in particular when it comes to how many people are dying from COVID-19. Black people make up 14% of the population of the state of Michigan, and thus far we've made up 40% of the people who have died. This disparate impact, these health disparities they are something that have been present, unfortunately, when it comes to health outcomes for generations in our state and frankly in our nation. The difference though is that COVID-19 kills quickly. And so we need to act right now in the midst of this pandemic to try to put interventions on the street to impact the greater risk of infection for many communities in poverty and communities of color and Black communities in particular, so that we can decrease that mortality rate. I think there are a lot of factors at play. Some of them are the historic social determinants of health. People who live in poverty, for example, can't afford to only go to the grocery store once every few weeks and spend hundreds of dollars. So they need to make multiple trips out to do it. In cities like Detroit, where 30% of people don't have a car and they're relying upon public transportation to make those multiple trips, riding public transportation puts both the drivers and professionals who work on those buses, as well as the riders, at greater risk of exposure because they have to come into contact with people and with things that a lot of people come into contact with. The people who are working at the grocery store or who are working for the utility companies, these are disproportionately low-wage workers, disproportionately people of color, and those folks are at risk of exposure because they're out working every day as well. And those are actually a lot of union jobs. And so that's why we have labor represented on the task force. So we want to think of interventions that can help decrease these exposure risks. And then when it comes to treatment, ensuring that there's no discrimination, there's non-discrimination when it comes to the protocols for delivering treatment, for administering testing and treatment, and making sure that we're responsive to people's needs if they are test positive for COVID-19. One of the other first early actions that we're taking is ensuring that medical providers, hospital systems, and counties across the state of Michigan are actually providing comprehensive demographic data back to the states for this analysis. We still have a significant fraction of deaths and infections where the race is unknown, so we're working to fill those gaps. We're also going to be calling on the federal government to be consistent with the demographic data that it both collects and shares, specifically the CDC and the National Institutes of Health. Congresswoman Brenda Lawrence, who is a member of the task force, has been a leader on calling for this from the federal government. So we're working with her office as a member to be able to fill those holes, because filling those holes are key to understanding and making the comprehensive analyses we need to. Interventions that help to reduce the mortality rate in vulnerable populations, they will benefit our population overall. If we identify protocols around sanitation, if we identify how to administer treatment in a way that is efficient and effective, that helps everyone. And so it's important that that work happen at every level, that people, that medical professionals, that researchers, that philanthropists, that workers, that employers, that families are mindful of these things. It will help us lessen the deaths that are happening from this virus. It'll help us slow the spread by people making choices to stay home and stay safe. And for those who are not able to, they'll be protected by those who do. And so I think that we all need to be thinking about this. This is an all hands on deck moment and an all ideas on the table moment.